We want to have a calmer bladder, not have to rush to the bathroom, not worry that we can't get there in time, and maybe not even have to go as often, or maybe not go as often at night. Okay, we're going to move on to the second strategy. This is what most people think when you have any pelvic floor problem, right? Just do your Kegels. You'll be fine, right? I mean, have you guys read that, been told that, done them? It is so saturated in our society that it is this magic cure-all exercise. And I want to set that straight. It is one exercise that can be really helpful for the pelvic floor if you need it. And the only people who need it are people who have weak pelvic floor muscles. Okay. So if you don't have weak pelvic floor muscles, in fact, if you have tense pelvic floor muscles, then Kegels would be the exact opposite of what you need to do. So they are far from a fix-it exercise for everybody because everybody's different. There's not one other part of the body that I can think of that so across the board gets recommended for everyone to do one exercise. I mean, it's pretty crazy. So this is a really important one. I want you to think of yourself in one of two buckets. You're either going to have some weakness, and we'll talk about what that means, or you've got some tension. And yes, of course, there's gray areas here, but just for simplicity, I want you to think, which one do you lean towards? Okay. If you look at this chart, you're going to see it says underactive pelvic floor muscles or weak. That also means weakness. Overactive pelvic floor muscles is kind of tense. Okay. So think of it two different buckets here. If you look at the first line on both sides, what do you see? Urinary urgency, frequency, and leakage. Both situations can lead to the same symptoms that we're talking about today. The key is which bucket are you in so that you do the right thing, so that we stop having the urgency, the frequency, and the leakage. Okay? So, what are some other signs to help sort out which side do you belong in? You'll see on the underactive or weak side, difficulty holding a Kegel more than a couple seconds. So if you try and do a Kegel and it's just hard for you to hold, you feel it kind of melt away, then that can be a sign that you're weak. If you're on your feet a lot and you feel some heaviness or vaginal pressure, sometimes that's kind of common late in pregnancy, but after the pregnancy, if that does happen, then you might be on the weakness side of things. If you use tampons, difficulty keeping a tampon in place is a really common symptom. Maybe losing a little gas if you bend over or lift or do yoga. That can be a sign that there's weakness. And then sometimes getting to like having some bowel urgency or difficulty controlling bowel movements is on that side as well. Okay, so that may help you figure out if you're over here. The other side of things is tension. Now, what causes tension? A lot of pain symptoms cause tension, right? Any kind of pelvic pain, it could be vaginal, it could be lower abdominal pain, hip pain or back pain, because those are in the same area, rectal pain, any kind of pain, tailbone pain, that's not listed, but tailbone pain is a common one. If you have pain or discomfort in the pelvis, then there's a fair chance that you're over here in the more tense side of things. Difficulty fully or easily emptying your bladder. That can be a sign that you've got some tension there. Constipation is a really common one. Pain with sexual activity, another really common one, or with pelvic exams. Or just not being able to do Kegels well. You'll feel like you can contract, and what's really common is you can't really fully let go. You might feel it go a little, but you really just can't let go when you try a Kegel. Okay, so it's trying to sort yourself. It's kind of like Harry Potter's sorting hat. Figure out which side you belong in, and you try and figure out what do I need? Do I need strengthening, or do I need lengthening? Okay, for you that need strengthening, Kegels are the way. For you who need lengthening, relaxation is the way. I have a whole relaxation guide that will help walk you through. And then with Kegels, I actually have a whole little mini course if you need to know more about doing Kegels. But your big message for today is figure out where you sit, which side, so that you know which strategy might be most helpful for you. optimize your pelvic floor muscles so that you don't have as many bladder symptoms.